Good afternoon, everyone. Thank you so much for being here today, and welcome to Top Strategies to Grow Your Healthcare VMS Business. We've got just a little bit of housekeeping to go through real quick, and then we'll jump into things. If you don't mind heading to the next slide, Mark. Fantastic. Just a few housekeeping notes real quick. First and foremost, this session will be recorded and shared after the fact. If you want to rewatch anything, if any of your teammates were unable to join, you'll be getting that automatically straight to your inbox. Secondly, all of the attendees will be on mute for the duration of the session, but we do have the Q&A panel right in the bottom of the screen, and we have some dedicated time towards the end of the session to go through any questions you might have. So please, throughout the session, drop in anything you might be wondering. Thank you so much again for joining us. And if we want to move on to the next slide real quick. Before we jump into this webinar, just want to get on your radar an upcoming webinar that we have on June 14th, Leading Through Uncertainty, Insights from Lauren Jones, Maurice Fuller, and Tom Erb. As the economy continues to experience unpredicted shifts and uncertainties, it's critical for businesses to proactively plan for changes and take advantage of any opportunities in this moment. So this is going to be a fantastic session from some real industry leaders and with some fantastic insights. So I just want to put that in your radar. If you want to scan the QR code, that'll take you straight to the registration page. And I'll also be sharing out this link towards the end of the session in our chat panel as well. That's everything from me. I'm going to pass it over to Mark Hummel, and we're going to kick things off. Thanks, everyone.
Awesome. Thank you, Sarah. And thank you all for joining us. It's been quite a while since I have had the honor to do a webinar, especially around our awesome healthcare offering. But we're excited, both myself and Matt, to dive through an awful lot of stuff in the next 45 minutes. So just for a recap, for those of you who I maybe haven't met in our trips to healthcare land, my name is Mark Hummel. I am our Senior Director of Sales and Strategy here at Bullhorn. And Matt, if you want to introduce yourself as well.
Sure. I'm as excited as you are, Mark. I am a manager of solution consulting here at Bullhorn, and I work predominantly with our healthcare clients.
Awesome. So the two of us are going to kind of go back and forth on a lot of this content that we have prepared for you guys today. We'll drop off the screen so that we can give the real star of the show, which is everything that we want to show you guys here. So want to give everybody a pretty clear expectation out of the gates on what we're going to cover in the session today, so that everybody can make sure that they tune into the parts they're excited about and utilize their time as wisely as they can here. First, we're going to hit this awesome healthcare market today, kind of a look at what is 2023 bringing us, because we're not in 2022 anymore. And so much has changed in how we're starting to see teams prioritize the efficiency that maybe for the last 3 or so years in the height of the pandemic, with the height of positions and bill rates, maybe efficiency wasn't the biggest priority at the time, and now it is very much so made a little bit of a resurgence here. But we're going to walk you through not only what those insights are for the industry, but how we're seeing clients address those efficiency needs through kind of their playbook. So we're going to show you a little bit of product in this. We're going to talk through a little bit of best practice. But as always, we're going to make sure that if you guys want to have deeper dives into any of the attributes that we're going to show as part of the Bullhorn Healthcare Edition here, make sure that you chat with your account manager, and we can walk through with somebody on Matt's team a more detailed understanding of what some of the functionality is that we're going to give kind of a high-level overview as part of a playbook today. So that playbook looks like what we have on the screen. How do we make sure that we have all the data in one spot? How do we give clinicians what they want, give our clients what they want? How do we keep score on how we're doing with those two attributes, learn from that score, and then implement it and repeat? So that's really what the premise for today is. We're going to jump straight into kind of giving us an understanding of why this is important. So what is the market today? Why has that conversation maybe even changed since Q4 of last year, certainly since Q3? This is kind of how we've bucketed these challenges. We're going to go through some data here that's across both our grid industry survey, which has been a survey of staffing company leaders as well as clinicians. We're also going to walk through some of the publicly available data from quarterly earnings within the healthcare space. And we're going to talk a little bit more about some of the stuff that we've learned from being on site with our clients. We've kind of bucketed into these three things being the key drivers. The COVID-19 impact on jobs being the obvious elephant in the room, but that now in 2023 leading to not just the limited provider supply that we've had, but that's gotten even worse as we've had some of those burnout attributes come into the clinician space. But also the profit margin squeeze, which I think is somewhat new and nuanced to the beginning of this year. So what does that talent shortage actually look like? Well, the good news is that hospital delivery organizations and healthcare systems can't afford to not still have great relationships with their staffing suppliers, because especially in the field of RNs, this talent shortage is bad, as we knew. McKinsey reported in 2022 that there was going to be somewhere in the neighborhood of 150 to 250,000 nurses short by 2025. Well, now this new research from the NCSBN organization actually elaborates that that's probably getting even worse. With all the burnout that we've seen from the conditions with nurses feeling like they're overworked and the extra stress that the pandemic has given to them. We've seen already 100,000 RNs have left the industry. 600,000 in a survey have actually dictated that they are planning on leaving the industry. And that number brings us to 20% of the current RN population in North America being at risk of no longer being in the industry by 2025. So huge numbers that even extrapolates what we've learned from McKinsey's estimates just a year and a half ago. And the interesting part for us in that study is, as we look at the aging population of all of our different labor forces across all categories, not just healthcare, one of the big pieces is, can we track that there's a decent amount of sub 40 candidates that are in the market because they have longevity in career typically, that continue to bolster our labor force. Well, of those candidates, 189 of them, actually 189,000, excuse me, were younger than 40 years old. So that means that not only could we possibly be in for a large talent shortage, but that large talent shortage could persist for quite a bit of time, being that we have even the youngest portion of our population of RNs saying that they are thinking about leaving the nursing field. And so that's really started to put some pressure on the margin piece, which is interesting because while we still have this short supply, as most of you have probably seen with your interactions with clients, we've heard about it in a lot of our meetings to date, that your clients, the hospital systems, the healthcare systems, are under a lot of pressure from their governing bodies to lower their contingent spend, lower their cost of contingent labor, and to right size their labor forces. So we've seen a lot of conversations around not just having great relationships with suppliers for travel nurses and locum tenens, but also having suppliers who really have a grasp of the data well enough to give them help with forecasting their demand, forecasting their need for labor in these systems so that they can right size the ship and lower their contingent spend. So we started to see that play out in the market. Where we're at today is still about 30% above pre-COVID levels, but we are seeing quite a bit of softening in the order volume across all of our data across our clients today. So we're down, but not down to pre-COVID. The other piece, though, that is interesting is the bill rates have come down considerably. So again, if we compare this to the height of positions and some of those crisis bill rates, especially, we look at Q1 of 2023 versus Q1 of 2022, we see bill rates across a handful of RN specialties that we looked at here recently is down 20% from where they were at in Q1 of 2022. So lower bill rates. The upside is we've seen that for the most part, pay rates seem to be in line. So expectations from the clinicians are being adjusted with that bill rate coming down. But what isn't normalizing is some of those pass-through costs. So we've certainly heard a decent amount about, housing and other pass-through costs that are associated with the clinician have not come down, which has put a little bit of a squeeze on margin. But the main reason that we're having this conversation today, quite honestly, is this secondary piece of firms' SG&A costs. So the way that we've seen customers service these jobs when they had the height of the inflated jobs opportunities in COVID was some of them were certainly efficient, but they still had so much volume that they threw extra headcount at it and extra advertising costs as well to try to really attract that candidate pool. And so we started spending at a level that we were all comfortable with when we had bill rates and positions and fill rates at the rate that they were at. And now that we've started to see some normalization of those other two pieces, the SG&A cost, and you'll see it in most of the public earnings calls across all of staffing, not just within healthcare, but that's really come under the microscope of how do we align the cost structure that we have internally with where we are now at in the market, 1 year removed from the height of the positions and bill rates that we've had. And so it all comes back to how do we become more efficient with what we have so that we make sure that every opportunity that we have an at-bat with can lead to better fill rates, better conversion from a candidate perspective, because all those costs are now under the microscope of how much does it cost us to acquire a clinician? How much does it cost us to actually fill a role? How much spread per head or how many gross revenue dollars or gross profit dollars do we have per recruiter, per account manager? All those pieces, if you're measuring them, that's awesome. You're probably seeing that your spread per head is going down considerably, and it's now about how do we get more efficient to bring that back to those levels. And that's why we see this being the top priority for the clients, that we've surveyed in our grid survey. Digital transformation is all about how do we get that data into the system in one spot so we can measure it and so that we can build efficient processes off of it. Improving that candidate experience being a close number 2, and candidate acquisition as a number 3. All of that being, we're spending a lot of money to acquire this talent. How do we make sure that once we have them in, we've paid for that access to that clinician, that we're utilizing that relationship for redeployments, for re-ups on contracts, et cetera. And that's the key places that we're seeing customers focus their playbook, is how do we grow that provider loyalty. Hopefully that accelerates our ability to fill roles faster, but also to work to get candidates roles faster, drive compliance and maintain financial health. So how do we get, once that clinician is worked through the process, we want to get them onboarded quickly, not risk any lapse in start dates, so that we can get them billing and redeployed after the assignment. So that's where we start. The jobs, they're still coming in by the thousands of positions every month for the majority of our customers today. And we thought this was an interesting look of how we've seen a lot of these jobs come into systems when this isn't an automated process for our customers. So the first piece of this, you probably have seen this before you did your digital transformation efforts yourself, that all these opportunities across all these different VMS platforms that we have, having customers that we've worked with that have 10 unique portal logins all the way up to 90 unique different portals that they're getting job requisitions from. We've seen 3 ways that once that job hits an inbox, that gets into a customer's applicant tracking system. One, and the most, the way that we're trying to avoid is to make sure that we're not doing that manual effort at the desk level. So before customers, were able to automate this interaction, we were seeing that all this comes into an inbox at the recruiter level. The recruiter then is probably segmenting those into different inboxes or different labels on that left-hand side by these jobs are in this state, these jobs are this type of job. And when they get that clinician on the phone, they're really kind of ad hoc with their own organizational system, trying to find the jobs in their inbox and hope that they have the most current, up-to-date, this job is open. But the other piece of it is we've also seen customers pass around that sheet that has everybody's login on them, and they're going to log into the VMS, find that job while they're on the phone with a clinician, and work that process with the limited jobs that they have in front of them to that one VMS. So we know that's not scalable. It's all about getting those jobs all into the system so that we can drive efficiency, so that every call that we have with a clinician, we can give them the full breadth of all the positions that we have access to. And that's what brings us to a lot of firms. The next step for them was manually doing this, but centralizing that effort. So doing an offshore model, doing a data entry model where they get all those jobs in, but they're not in real time. And now I think, as most of you on the call are probably already doing, we're seeing a huge uptick in the let's automate all these jobs, get them in the system, and be able to work them from one central source of truth. And the reason that's important is when we look at all the things that you want to be able to do as that job comes in, updates, closes, we want to have the ATS, the applicant tracking system, completely in line with those changes that are happening across all these other systems. You want one true source of truth that then kicks off our ability to do more innovative things with it that help our candidate relationship. But to do that, as you guys have probably seen, these jobs are not necessarily designed in the VMS to be easily ported into an applicant tracking system. You have to think about first, what is this job? So an example of something that we've built around our tool to make sure that we have scalability in all these positions. On the right, you probably recognize those. They might be from a VMS like Medifis or Health Trust, et cetera. But those position titles are not typically as easy as just this is an RN that's looking in the labor and delivery unit, or this is a cardiovascular RN, et cetera. You got all this extra stuff in the job. So we built this intelligence with our early healthcare customers to really be able to understand what is this position that we're looking at, map those positions once in the system, and then have them be able to flow going forward. So every time we see a different variation of RN, registered nurse, reg nurse, et cetera, all those pieces are going to capture automatically by the system and already map accordingly. And the other big piece is that you guys work with a lot of facilities. So healthcare facilities, healthcare campuses, they're complex, and it's pretty rare that if you look through your entire applicant tracking system, you have the exact same naming convention and addresses that you would see in the various VMSs. So what we've built in partnership with Google is an understanding of how do you actually look at these addresses the same way that Google looks at them. So basically, if you were able to type an address in from the VMS and an address in from the ATS, if they were close enough that they were matched by Google, that Google would take you to the same place, we automatically link those in the system. And why that's super important is you guys work with hundreds of thousands of different facilities. If we map 80% of them out of the box and you have 20% of them to work with, that keeps those jobs flowing into the system versus having to manually stop for each one of those pieces and map them. The whole goal is we've got to get to a spot where, as a recruiter, as an account manager, we log in, we see this jobs list that's clean, that we can sort by what's the category, what's the specialty, what's the category, what's the setting, so that when you have a clinician on the phone, you can easily just sort this list and see all the applicable jobs across every different portal that you have access to. And so as long as those jobs are all flowing in with no deterrence, that's what the big piece of both of those mapping exercises are, then you have the ability to work these jobs live in real time. And that's important because we know that's only one side of the equation, and arguably not even the most important, being that there's a giant clinician shortage. So much of this is how do you work the candidate side of this equation. So all this money that is spent on the brand recognition, the podcasts, the ability to drive people to your social sites, all of those pieces funnel into services like this that everyone works with. How do we get the job out to those services, get it cleaned, get it ready for clinicians to be seeing that job in these sites, and then how do we bring those jobs, or excuse me, those candidates back in to your system as well. So as you have these services that are bringing those those candidates in on these jobs, we want to make sure that the first thing that candidate gets is that white glove treatment of you've expressed interest, and now we are going to proactively make sure that we have a touch point with you as well. And so that's where, if we talk about, one of the things that's really important once we have clinicians in the system automatically and jobs in the system automatically, is how do we leverage that from an efficiency gain perspective?
Mark, it's interesting that we talk about the efficiency and we go back to that playbook of accessible data, giving clinicians what they want and giving clients what they want, having the ability to keep score, learn and repeat that process of what works. So we think about that engagement of all of those clinicians that are coming into the system. All that information is coming in, but we also want to present a recruiter with the ability to engage in those meaningful activities. So capturing all of that information that might pertain to what the journey of that clinician might look like, but also giving the clinician or a provider the ability to self-service to capture that information, but provide that right to a recruiter. So taking those unique taxonomy of skills and of those unique job orders, matching that with clinicians and presenting that right back to a recruiter. When we see that from an efficiency gain perspective, in the old days that you talked about, a recruiter might get a job order in their inbox. They might have a list of candidates. They might outreach to those clinicians, qualify them, match them to a position, and then have the program manager submit those back. Today, what we're seeing from a best practice is start of a day. Once that job order comes in, leveraging that matching capabilities and identifying those clinicians right off the bat. So those tend to impact those traditional pieces of time to submit, but it also takes into account what is the power of leveraging our own database versus finding talent outside of a unique experience that we have in our own database.
Yeah, absolutely. And to Matt's point, what we're showing here is that ability, like he said, for the recruiter to walk in, open up a position and already see candidates expressing interest and being a portion of the way through that process in that AI submission bucket. And so, Matt, I think everybody's curious of how did those clinicians actually get there?
Yeah, so really the point here, Mark, is wherever that initial touch point is, whether that's an initial applicant, whether it's a referral that came from an existing clinician out there, whether it's a new lead that was transitioned from one of our marketing efforts. Once we've gotten that clinician's experience and their attention, let's give them the opportunity for self-service engagement. So that's a trend that we continue to see that, in your day-to-day life, Mark, you might access bank information, you might access ordering takeout food and having that be ready. You might access things like information on healthcare providers and communicate with your doctor in that way. The same type of experience is one that we're seeing more and more clinicians ask for. So let's find out what their skills are. What are they interested in? What locations of interest, perhaps if they're in a travel segment, and let's apply the right strategy now to win that relationship. So how do we now empower our recruiters who have, that meaningful information to really engage in the most meaningful activity with that clinician?
Yeah, I think that's spot on. So we've got all these different ways, like you mentioned, that a candidate, that a provider might show up to a screen like this, where they can start that self-service journey. So now they've shown us that they've got engagement, they're interested in a particular position or just us as a brand. How do you leverage automation deeper to, capitalize on that attention that you've now grabbed?
So it's all about talent pools and where they are. So leveraging automation, leveraging the power of the database allows Bullhorn clients to easily have clinicians in talent pools that are established, they're maintained right in Bullhorn. And as that talent is engaged and nurtured, providing that self-service now ability to apply to the right orders that they've engaged interest in, maintaining a level of visibility into that engagement. And this is what talent and clinicians expect. What we've seen is, you mentioned the grid survey, part of that communication we've heard back from clinicians is that they're expecting recruiters to reach out to them at least once a week. And that does not just mean while they're in the search process for a new position. That means when they are on assignment. So you think about the impact that has on a recruiter's workload every day. This expectation of a clinician is going to continue. And as we think about strategy around that initial engagement strategy, coupled with nurturing that clinician through their assignment, is the difference between having one placement with a clinician and perhaps having multiple placements and even expanding that exponentially through referrals.
Yeah, I think that's key. Like you said, if you want to talk about the efficiency of the relationship, you spent the time and the money to get the provider engaged with you as a brand. And I think what you're showing here on this screen is pretty awesome. The ability for them to self-identify into talent pools that you can now build campaigns around, continuously providing them jobs as they go on assignment, as they roll off for a redeployment, et cetera. And I think, a lot of times we show these types of screens in demos and walk through, what that provider experience can look like. But maybe you jump into kind of how flexible that can be and how responsive that can be and what's powering it on the back end.
So we're going to take a little bit of a look into the back end or the kitchen of this restaurant operation. And the beauty of this is there's an automation engine that can adapt and take a look at that logic that we're capturing. So perhaps segmenting those talent pools based upon their experience throughout the process. This allows our staffing firms to engage a repeatable process that can be both measured and modifiable. So this is so important when we look at healthcare staffing in the past 2 years, but even on a micro level in the past 6 months, we've seen different segments have very unique challenges, but also present very real opportunities for our customers. So customers that have adapted an automation strategy in this capacity can flex, can pivot, and can really take advantage of those opportunities that present themselves.
Yeah, I think that's amazing. It feels like it's not just that we're hearing, obviously, clinicians and providers want to have that self-service and have a responsive self-service, but it's also about how do we create these automations, create these omni-channel interactions with clinicians, and then we learn from what's working and what's not working. So maybe you can give us a little insight on, how do we see that learning taking place?
There's a few different ways. One of the key places of learning, though, is to have tools that measure the effectiveness of that engagement strategy. So this learning often allows us to identify opportunities to improve efficiency, opportunities to enhance perhaps a prioritization of all of these orders. You had that scrolling list of orders, but how do we really prioritize those to put the most effective measurement and engagement strategy in place? And simply stated, Mark, working smarter, not harder. We all know the efforts that recruiters, staffing firms put in day to day, and it's really about providing that effective visibility into it, but also to tweak along the way, because opportunities for improvement present themselves every day within the unique challenges of staffing and recruiting.
Yeah, and I think that's the key, right? Is one of the biggest things when we have our on-sites or when we have deeper dives into automation strategies, I think the place that we always try to start, aside from what are we actually trying to accomplish is how do we measure what we're trying to accomplish. And I think what you're showing here, Matt, around, just one of the dashboards that's available, when we're looking specifically at these different automated outreaches, these, automated omni-channel experiences, is how do we treat this, much like a marketing program would treat a large group of customers that they've segmented. So how do we, A/B test the different messages that go out to the clinicians and providers that we're working with? How do we measure based on what that message is, what that message contains, how effective we are in email versus how effective we are in text? Do we start to see trends of, early engagements with clinicians being better in emails versus text messages? Do we see click-through rates being better in one of these, overall responses, et cetera? I guess the point that I would make there is, if we can, talk clients through how do we base our strategy off of measuring the effectiveness of the messages that we're putting out there, we normally see a much better, efficiency, a much better turnaround of the marketing efforts, since there's so much effort going into it. It's all about how do we capitalize on it. And so I think, Matt, then as we're talking about the measuring piece of this, once we've measured, what's the other big thing that we'd be, having the opportunity to do now that we've got all this data in our system?
So we've talked today about having the accessible data, both from the job order side as well as the clinician side. We've talked about giving clinicians what they want, serving that information. We are now talking about measuring that data. And in short, this is going to give us simply more opportunities to fill more orders. And the ways that we're seeing that from an impact perspective, let's take a recruiter and let's talk about the enhanced productivity to be able to work more job orders by establishing more meaningful engagement time with providers, whether that be an initial screening call, whether that be a closing call, travel negotiation packages, having the ability to automate those key steps that clinicians have told us are key. First day check-ins when that first paycheck goes out, opportunities for redeployment, enhancing perhaps some of those referrals and some of the opportunities that we have to actually get a testimonial. All of those pieces, when you look at those individually, they can be impactful for one experience for one clinician. You mentioned the term omni-channel, Mark, and part of this strategy is taking a look at the uniqueness that each one of those clinicians has and applying a centralized strategy that is tailored and malleable for each of those individuals. So you mentioned here the opportunity to double down on the opening, and what we're seeing here is by having that initial outreach and matching those individuals that are eligible and ready to go to work and that we have the right engagement with, that also gives us enough time to identify people that we don't yet have relationships with and bring them into the process, because once they're in this experience, they're probably not going to crave another experience, because all of the engagement elements that we hear from clinicians are there, that once a week, once a day, whatever that leverage of communication that you need as a staffing firm is there at your fingertips.
Yeah, I mean, I think that's obviously so important when we think about, again, the cost to acquire a clinician, the cost to acquire a provider, to get them into your brand ecosystem and get them brand loyal. But I think that, as somebody who's had the opportunity to work very extensively with so many of our healthcare clients, but also see the other side of staffing from the professional perspective, something you've probably heard me say if I've ever been on site with your team is, healthcare staffing has known candidate first, candidate shortage for so long now. They've always worked a candidate first approach. Well, that comes down to, even in practice, having a clinician on the phone, finding the jobs for them, and then the next thing they do is go back and find the next clinician. one thing that professional, though they're just learning that piece, the thing that I think healthcare has the opportunity to learn from professional staffing industry is, now that we've started to work this position, let's better our opportunity to get a fill from this position. If not with that first clinician that came to us, let's run that reverse search, that find matching candidates from within the ATS, and see what other clinicians that we have that we're working with that meet that requirement. And to Matt's point, sorting them by things like how ready they are to work, how many, if they've already been on an assignment with us in the past, but how do we not move right off of the job and go back to finding the next provider that we want to find more opportunities for, and instead double down with just a couple clicks and find out who else would be a good fit for this. And Matt, I think there's a piece of that too that kind of ties together, how do we know what candidates are the right candidate? And here's a trend that I think we've been seeing quite a bit on. Maybe you can give us a heads up on what that search is looking like.
Yeah, so it's all about visibility right into that individual clinician's experience. So you think about all of the levels of engagement that clinician has throughout the process, providing not only a mechanism to easily identify those clinicians that are ready to work, that are engaged with us, but what has their level of engagement been? What positions have they been looking at that we've perhaps been marketing to them? Where and when has their activity led to quick return? So when have they become from a passive applicant to a really active one? Let's trigger those events as well. So we're showing here from a power of the fingertips of a recruiter to engage with a one-click search here. But the other component here, Mark, is how do we engage outreach with a recruiter from a notification perspective, whether that's an email to the recruiter, whether that's a notification on a job, but also promoting the right opportunities to those engaged candidates, because those that exhibit levels of engagement certainly are easier to convert at that point of engagement. But how do we keep them all engaged throughout the process?
Yeah, absolutely. I just want to double click on something that you said there, Matt, is so important. That engagement score, and Matt talked about that being a key search criteria when we're searching against the job or searching through a list of candidates. And that's what we're seeing on the screen here, is the ability to add that as a column and put that as a minimum score requirement. But what's going into that's actually pretty amazing. So to Matt's point, every interaction that they have with you as a brand that we track goes into this scoring algorithm that tells us how engaged we think this candidate is with your brand. So we basically are assigning a score based on how many of your emails have they opened, how many text messages have they responded to, how many links for jobs have they looked at on your career portal. All of those pieces go into an engagement score that tells us how much has your clinician pool been responsive to what you've been sending them. So just to really put the dotted line forward in front of everyone, if you run this search and you're looking for only candidates that have had a 90 and above engagement score, you're now getting this curated list of people that work in that state that you've searched for, people that have that healthcare certification that you're looking for, and have engaged with your brand most likely pretty recently. And so you've done all that investment to get this clinician interested and engaged with you. You should work a process that bubbles them up to the top when you're considering next clinician up for an opportunity. And so I think, Matt, like, that was awesome that you walked through that. There's one big piece that I've been excited to announce as well, and it has to do with what do we do once we get these clinicians worked through this process. We've got a provider that we feel like is a good fit for the role. The next piece, as we all know, is we have to go submit them back to the VMS. And so something that you guys are all getting a preview of before we actually talk about it quite a bit at Engage is that we know that one of the processes that's a little bit tedious is getting that candidate, that clinician, back into the VMS. So I am excited to announce officially, I know a few of you have probably heard this in some of our on-site conversations, but we have a very robust roadmap for VMS candidate submissions. And I say roadmap, but I will call out that B4 Health is already actively under development and actually now in beta. So we look at, now we've got a clinician, we need to get them back into the VMS. Typically we have recruiters logging into, these different platforms, putting together a, packet of their credentials and submitting that back, in the VMS platform itself. So we've seen all kinds of challenges with that. One, you either have to have a list that goes around the office that everybody has logins, or we have to send it to a centralized person to make that submission. Every recruiter that can submit to the role, and that's all permission-based, needs to be able to submit without having to worry about an additional set of credentials. And so that's our mission going forward, is to get these VMS platforms that we work with from a jobs perspective, one by one, built for the submission process. So B4 Health is actively underway today with a beta program running in the background. We'll have more information about that at Engage. So excited to dive into that with everyone. Health Trust is our next up on the list. Great partnership with both B4 Health and Health Trust as we build these unique integrations in tandem with their development teams. And then we have this third one of Einstein 2 on the list, but this one is really, quite honestly, still up for conversation with all of our clients that are utilizing the tool today. So if you're utilizing VMS, or if you're utilizing the healthcare edition of Bullhorn, we'd love to get your input on kind of what your prioritization of these looks like, because we want everybody to be able to do this cool thing, which is, while we're still in Bullhorn, on the requisition, pushing a button that says submit to VMS. And in this case, we're actually walking through what happens for the B4 Health integration that's currently being utilized by our beta customers. Is we can grab that job, we dynamically grab all the questions for the job, all the required fields. We pre-populate the fields that we most commonly see in candidate records, so stuff like name, contact information, etc. You do still fill in some fields manually here, but then we upload that credential packet that B4 Health requires right here from within Bullhorn, push submit, and while we're watching it, sub 10 seconds, get that submission back to the VMS. So not only that, but as that submission advances in the process in the VMS platform, so when that submission goes to offer, where that submission goes to place, all those pieces flow back and update in that submission record in Bullhorn. So not only do we not have to leave the system, but probably even more importantly, we capture all the data elements along with that submission. So when we start to try to think about how we measure this, we're not worried about, do we actually have all the data points necessary to look at how quickly we submitted a candidate, look at how quickly we got a response from the hospital delivery organization. All those pieces can now be measured from within Bullhorn through tracking all that data. And so, Matt, now we've walked through how you've got the candidate, the clinician in, how we've utilized that engagement to the most efficient way possible, and how we've now submitted them through this automated system. I guess next is kind of back to, how do we get them to work quickly? So maybe you want to walk us through that piece.
Yeah, Mark. So the beauty here of all of the things that we've talked about in strategy can impact the ability to clear those clinicians to work. And it's all about speed. So if we look at the next slide here, speed in credentialing while driving compliance, so those clinicians are able to start faster and your firm gets to realized revenue sooner. So thinking about that increased efficiency and meeting that clinician where they are by allowing them to upload and self-service credentials on demand if need be, but also providing that single source of truth to store those credentials in our repository, have compliance visibility within a compliance manager to know where to focus on and track and know who still needs to be cleared and credentialed. And then leveraging that power of automation by ensuring that our clinicians are staying compliant, who are on the order. Those clinicians that are extending assignments, we have visibility into that, and then building that all the way into our strategy when it comes to redeployment and making sure that those are in alignment with the open orders that will be flowing in. And the question then becomes, how do we do that? And if we could go to the next slide, that single source of truth, right? So having that capability of looking at those credentials that in this case have been uploaded right by our clinician, allowing that to easily match to those order requirements, presenting those, and really identifying opportunities we've talked about leveraging our own staffing database, or our customers leveraging their own database, having the ability to increase that redeployment and identifying any compliance risks prior to or during assignment. Those are all factors that the more we can automate those, the easier it can be to place individuals and then measure that performance when it comes to overall VMS business.
Yeah, and I think that's spot on, Matt, because so much of this has been about how do we, measure that performance and then learn from it. So I know we've just got a couple minutes left here, but it'd be awesome to, get a little walkthrough from you on some of the ways that we've seen customers leveraging Healthcare Edition to do some measuring of that.
Yeah, one of the most common ways that we see it starting is we talked about that recipe of playbook of keeping score, learning, repeating, but also giving clinicians what they want, giving clients what they want. Part of giving all of that is giving the right information to the recruiters, giving the right information to the program managers, to the operations managers, to the compliance specialists, giving the right information to the managers in the staffing firm. And it all starts with analytics. So what we often see for best practices, let's think about this first and foremost at the desk level. What are those insights that we can provide to recruiters to allow them to then identify where and why the attention is deserved on a specific area, and then ultimately bubbling that up for the ability to see trend analysis, identifying opportunities against SLAs and for growth, and to really expand the footprint both in the clinician relationship as well as the client relationship, growing the business from both sides.
Yeah, I think that's if there's one theme that's common here, it's how to, the route to efficiency is measuring first to understand where we have the opportunity to be efficient. And that's why, I've loved seeing how clients have utilized within the Healthcare Edition this analytics capability. Like you said, Matt, how do we look at it from a job openings perspective and the amount of coverage we have on those jobs, but probably most importantly for clinicians, especially in today's market, is how do we look at the lead sources that we've gotten these clinicians from? How do those lead sources perform against one another? Really starts to give us the opportunity to know where we want to make those additional investments in our SG&A as well. And so I know, Matt, we went through a lot and we are a little bit over. That being said, love to discuss deeper any of the questions that anybody has around the Healthcare Edition, certainly at Engage, and reach out to your account manager. I think we do have a couple of time, or a little bit of time, sorry, Sarah, for a couple of questions if we want to do it. And then otherwise we'll make sure that we pull all the account managers working with everyone here to see if we had any additional questions come out after this as well. But Sarah, we'll let you take a look at the Q&A.
Yeah, we have one question, and that is, you spoke about an omni-channel approach for interacting with candidates. Are there any trends or info you have about how candidates want to be interacted with?
Yeah, I mean, I think that as it won't be a shock to anybody from all the conversations that we've been having with you all in the first place, is certainly there is a huge push to text message interaction. I think we've seen that text message interaction seems to be the preferred method, over phone calls. But the interesting piece is the earlier in the cycle that we see that interaction happening with the clinician, so the less relationship you have with them, the more comfortable they do seem to be or the more responsive they seem to be, I should say, with email. So it seems like the trend that we've typically seen is the earlier in the relationship you are with a clinician, email seems to have a better return on, click-through return or attention-grabbing return. And then once there's a little bit of a relationship established, that text message piece becomes the primary communication all the way through. Once you start grabbing those onboarding docs and doing pre-boardings and all those pieces, obviously you want an automation strategy that starts to shift that interaction over to more of the digitized experience with the portal with the login capability for the clinician. So as that relationship improves, you go from, I'd say, email to text message to actually logging in to the portal. And once you've got them logging into a portal, you've got them pretty brand loyal at that point, which means redeployment should be an easy opportunity for an additional placement.
Awesome. Thanks, Mark. One other question here, and that is, our team has been trying to figure out the best way to distribute candidates that are being added to our bullhorn. Are there automated ways to handle this?
Absolutely. I think it depends on how fancy you want to get with it. The big piece within our automation capability would be to do something like a round robin with rules. So for example, if you have recruiters that work a certain vertical within the clinical space, so specifically RNs and maybe a certain state, or specifically RNs and a specific medical setting, you could have a round robin of the 8 recruiters that work that setting. Anytime we get a lead from those sources we showed on the previous graphic, automatically into the system, then an automation picks that up and round robin distributes those to one of your recruiters. I'd say the biggest thing is you can do static automations, round robins, all kinds of cool stuff. Whatever you try, it's a try, measure, and then adapt. So once you've done that process for a little while, see what type of lead conversion you have with that process and make tweaks accordingly.
Awesome. Thanks again so much, Mark. So another question just came in. What kind of AI technologies are you using to make recommendations for jobs or to track historical activity? We are interested in speeding up search and finding relevant information in general.
Yeah, absolutely. So the method that we use today is, I always like to call it kind of like the Spotify method. Basically, we have learned from candidates like this candidate or clinicians like this clinician have often shown high engagement scores and high likelihood of placement. So they've made it pretty far in the placement cycle or been placed. That's our barometer for comparing the candidate that you're looking at, the clinician that you're looking at, versus the jobs that are available. I will say, not to give it away, but hopefully everybody on this call is coming to engage. We're gonna have a lot of really cool announcements on some of the new stuff that we're working on around AI to give more customizable capability of what that AI is actually looking at and making the score on, but also to make it, to take that to the next level of how do we not just make those matches, but do some additional things once those matches are made. So I won't steal Matt Fisher's thunder on that, but definitely make sure that you make it to engage.
Thanks again, Mark. Last but not least, I know we promoted a webinar that we're running on June 14th earlier in the session. I just wanted to quickly drop that registration link in the chat in case anyone has missed that. Going to be a great session, and there's a link if you were looking to access this. I think we've wrapped up the Q&A that we have in, and I know that we are also past time. So thanks for everyone who stuck around a bit longer than expected. The recording will be going out to all of you sometime this week. And if you have any other questions, please reach out to us, respond to the follow-up email with the recording, reach out to your account managers. Thank you, Mark and Matt, so much for being here, and have a great day, everyone.
Thanks, everyone.
Thanks, everyone.